Hi everyone, my name is Manjari. I am an M3 student here at Virginia Commonwealth University, and I'm here to talk about my experience doing the family medicine rotation in a site in the Dominican Republic. We worked at this place called El Centro de Primer Nivel, which is a primary care center located in this neighborhood called Hato del Yaque, which is a very low income, low resource setting. And so a lot of these patients haven't seen a doctor in many years, so you do get a lot of clinical skills and a lot of clinical practice out of being in a neighborhood like this. So you work with an attending, her name is Dra Germosén. She's a phenomenal doctor and an equally phenomenal teacher, and she will teach you kind of how to manage such complex patients and what the common treatments are, what the common doses for those treatments are. So obviously you walk away with a lot of language skills. You learn how to say common medicines, common diseases in Spanish. You also learn how to understand patients when they're telling you about their symptoms in phrases like, I feel like ants are crawling on me. You learn to associate that with tingliness. So a lot of patients will talk to you in creative ways, and you learn how to interpret those kind of phrases in Spanish. And I think that this experience, exponentially increased my ability to speak Spanish in a clinical setting. So I would definitely recommend this for anyone that is trying to expand their Spanish knowledge. Secondly, you get to do a lot of opportunities like clean wounds, remove an insect from a kid's ear, give nebulization treatments, give vaccines, go and hear actual murmurs, because so many of these patients haven't seen a doctor in a long time that they have a lot of undiagnosed ailments. I got to elicit Murphy's sign in a patient, elicit costovertebral tenderness. All of these kind of complex physical exams that you learn in your first 2 years, you get to see in such a short amount of time in the DR, because just the setting that you're in terms of it being low resource, in terms of just the fact that these people haven't seen a doctor in a while or aren't taking any medications when they should be. So you do improve your clinical skills as well. And the last thing is that you really establish a sense of community with the patients around this clinic. A lot of my days involved walking door to door, canvassing the neighborhood, figuring out what illnesses run in the family, what medications each patient is taking, what medications they still need, counseling them on trying to come to the clinic every week to measure their glucose levels or measure their blood pressure, and also talk about things that are kind of more complex, like mental health or reproductive health, that sometimes you kind of have to be a little more circumferential about and nuanced about when you talk to patients. But it does give you that confidence to be able to talk to a little bit more of a conservative culture about topics like that. So I think you walk away with these three main skills. You walk away with improved language skills, improved clinical skills, and also an improved kind of cultural context in general with working with a population like this for as long as you do. So I would highly recommend this opportunity to anyone interested in becoming a better doctor in general, but especially if you're interested in things like community health in a low resource setting with specific Spanish-speaking populations. Thank you.